Hello, everyone, and the topic of our uh, presentation today is OCD, obsessive compulsive disorder. And my apologies for kind of looking at things in the mirror view, but tried a couple of times in the other setting, and for one reason or the other, I had some technical difficulties. So, sincere apologies. So, this is the best I was able to come up with in order to give you the presentation. So let's talk about OCD, and this is one of the diseases that, or disorders that's misconstrued. It has the huge stigma about it. A lot of people take it for somebody being superstitious and not realizing that there are a lot of other underlying issues with it. The first slide we will look at is symptoms of OCD, and symptoms are very wide range, and as everything else in psychology, everything is on the spectrum, right? Some people can never display any OCD issues, or some people actually live in that day to day, and it impairs their everyday life. So you could be under stress and display some of those things, and they are not limited to obsessions like persistent or intrusive thoughts, urges of images that cause distress, fear of contamination. Like, for instance, somebody can get this intrusive thought that where this water came from, and did they really clear it, and is it really filtered as it was said it was filtered? So that's one of the things that can cause that. Compulsions, repetitive behavior, like somebody would not step on the line on the concrete, or they will knock on the door 3 times, or use their door handle and turn that a few times. That could be some of the displays of OCD. Treatments. There are different treatments for different severity of the disorder. Some of it could be as little as recognizing the pattern, kind of grounding yourself, and realizing that you've fallen into the pattern of OCD. Like, for instance, you are under stress and anxiety, and you're like, oh, did I turn off my stove? Or did I make that phone call? And you're obsessing about phone call when you are actually on the plane flying and you cannot make that phone call. So those could be things. And um, other treatments could be like medications, SSRI, or that can help manage the symptoms. Also, fluoxetine or sertraline, deep brain stimulation, DBS. That's in severe cases that we have mentioned. Everything is on the spectrum, so different types of therapies come into play. Support groups, mindfulness, that helps a lot. Common, kind of like Alcoholics Anonymous, which is also a different kind of disorder. So you just come into the familiar group and help cope with the symptoms that you are experiencing. Next slide, we will talk about how it affects day-to-day life. It could definitely impact your work, relationship, self-care due to the time-consuming rituals may lead to social isolation, depression, or difficulty maintaining employment. Individuals often experience heightened anxiety when rituals cannot be performed. So imagine you have this condition and you have a very constricting work schedule, so that can be very stressful for an individual that suffers from this situation. So those things are very serious, and in a lot of workplaces, people are not very understanding or very accommodating to people with certain conditions. Let's talk about etiology. Who is likely to develop OCD? So it onset usually around 8 or 12 years old. Males prone to have it develop and having symptoms displayed earlier on rather than females. But it could be a lot of different things. It could be predisposition, it could be hereditary. So we can talk about different things. Risk factors, predisposition in the family. Doesn't mean that the individual is going to have OCD. No, it doesn't, because Again, you have other neurological abnormalities or environmental factors, because if you're in the environment of stress, if you're in the environment of abuse, mental, physical, whatever the case may be, so any person that does not have disposition may very well can start displaying those kind of symptoms and signs of OCD. But again, always seek help and always go see a professional to help you cope with those symptoms. Typical age of onset is 8 to 12 years, but early onset cases, they show to be more severe according to the researchers. Let's talk about prognosis and brain function in OCD. So let's involved hyperactivity in the corticostriatal-thalamocortical circuits, CSTC. So basically you have that ongoing thought happening. Imbalances in serotonin, dopamine, and glutamate are implicated in the disorder. With treatment, symptoms can be managed, but the disorder is often chronic, meaning that you basically manage your symptoms and it's very hard to actually cure it all the way. Healthcare challenges for OCD patients. We did touch on the fact that OCD is usually viewed as, oh, you are superstitious, or just don't worry about it, everything's fine, just why you need the psychologist for it. So what did you have this thought, everybody has these thoughts, right? As a mother, you're like, oh, I'm so OCD. In our society, it's so common to use those terms loosely, so we don't really think twice about it. But yes, misdiagnosis or delay in diagnosis, patients may not recognize their symptoms as OCD. Stigma, a lack of awareness, misconceptions about OCD, or quirky habit rather than a serious disorder, access to care, limited availability of specialized OCD therapies, particularly in ERP treatments. The next slide, we will talk about medication side effects. And like everything psychotropic, you will be getting issues with nausea, drowsiness, or agitation, leading to some patients to discontinue treatment. And that can be very, very dangerous to a patient, because you never want to discontinue any psychotropic medication without knowledge of your specialist. Considerations for healthcare providers. We're future healthcare providers, so it is very important that we are very cognitive about our patients and their behaviors. So sometimes we can construe it as certain, maybe it's their behavior, maybe it's something else, but we don't understand that there are underlying conditions to it. And non-judgmental language is important. Educate patients of treatments, monitor comorbid conditions, especially people with high anxiety and depression. Encourage family, educating family, and making sure that patient does not feel alone is very, very important and essential. Pop culture, this one is fun. So we all know a lot of celebrities are coming out with different conditions and are more comfortable talking about it. So yeah, one of those celebrities is Howie Mandel. He's a comedian and TV host. He's very open about his condition, and he's spreading awareness, which is very helpful. And let's get back to 1997. The movie called As Good as It Gets. It has a very, very beautiful showcase of how a person that lived in his nutshell actually broke out and was able to save life of a little boy. He was able to help his neighbor and that little dog. That little dog melted his heart. So it was an amazing movie. I definitely recommend to watch for better understanding of what the person with OCD can deal with. And I thank you for your attention, and thank you very much, and good luck in your future career. Goodbye.